Good evening, greetings of Global Professional IGP, greetings from the Institute of Global Professional IGP. Thank you all for joining us and staying with us today. Honorable Knowledge Seeker, today I am your host for the evening. My name is Bathum Das. I am from Bangladesh. Dear Knowledge Seeker, I am proud to be associated with IGP. IGP is Social and ISRF International Educational and Training Institute. In last year, we already served 35 million plus knowledge seeker from 100 plus countries. IGP programs and global accredited. We are connected to more than 450 plus profession and 4,500 plus organizations. Institute of Global Professional is an education institute that provides social work globally recognized and reportable research and community resource providing holistic social work and education. We believe that it's not effective training is one skill just requiring formal education. So we provide effective training and consultation to generate profession generation all over the world. We distribute our services locally, nationally, internationally to student job seeker, job holder, and also for another respective campus location and distance learning platform. We are an occupational and dependable institute. IGP is one of the famous online institute from all over the world. Our vision is education is not a business product, it's a part of our human rights. Based on our vision, we are trying to reach all corners of the world for free webinar, seminar, course, awards, mentoring, and counseling, etc. On the other side, we are also trying to offer more than 100 film services for free. Like we don't profile website, resume builder, cover letter, motivational letter, and ball knowledge platform for gathering general knowledge which can upgrade all day. Kids learning game, website, free course, converse sites, and many more. We help to empower you to learn to meet their expectation and dream and become highly skilled people. We implement several training program, webinar, and offline online courses for your author learner by professional trainers, speaker, and coaches. Our sessions are conducted by global junior professional tutor who can improve and promote the education of the adolescent person. This is being knowledge is crucial for the Institute of Global Professional. We believe that knowledge is level, light, and vision. So we try to understand each of the generation and start the research and practice method. We must have a genuine concern for the learner to represent more diversity, growth, and innovation are required to lead a session with strong compassion and integrity. IGP members are committed to offering effective best quality service and continuous improvement so that individuals who seek information can improve their skill level and value. Before we move to the next, let me remind don't forget to share, tag, and mention comment boxes. Support is very valuable for us. Thank you. Before we move to the next, let me remind don't forget to share, tag, and mention it in the comment boxes. Support is very valuable for us. Thank you. Moving to the next, we will continue support. We already completed 2,186 webinars successfully. Moving to the next, we will continue support. We already completed 2,186 webinars successfully. Dear RGP speaker, participant, and well-wisher, at this moment, this is a very important message for you all. We change and design our website www.eduigp.com. On this website, we have surprise for everyone. Hope you'll be benefited. We launch our new website where you can find all our previous activities together with lots of new features. But one strong point is that without an account or login, you cannot enjoy our service. So create an account for once with profile information. Note that with profile information, you'll enjoy a feature with mismatch that you cannot do anything here. From now, you have to participate in live quiz competition on our website. We replace live. You have to join directly on our website. Now you can check all of our previous webinars with verified certificate. Now it's easier and time oriented because after the session, we will not provide any code for certification. You have to take part in exam after that. If you pass, you will receive your certificate. Otherwise, not. But you can take part in an exam only immediately you pass. If you're an IGP speaker, you have previous certificate, speakership certificate. If you're a host of IGP, you can always certificate of gratitude. If you're an online life quiz competition winner, there is a real participation. Selected for lifetime membership, then you can download certificate lifetime membership easily. Besides this, if you participate in any award function which organized government support with the IGP, you can download that also. You can still prepare and download 18 taxes certificate from our website with the mini certificate global professional membership, certificate global influence in the pandemic. Certificate of active social activities in the pandemic, certificate of achievement has been knowledge in 2020, 2021 and 2022, certificate of participant awareness is one authentic assessment in teaching learning, certificate of participant awareness is teaching their foreign language and assessment. Certificate of participant awareness is digital classroom engagement tool, certificate of participant awareness is for the new training education. Certificate of participant awareness is 5 happy scholarship leadership and medical skills, certificate of participant awareness is 6 standard innovation in mathematics education. Certificate of participant awareness is 7 research comprehension approach, certificate of participant awareness is 8 aptitude in a special program that. Rural district mathematics certificate of Ajibika Padam Ambassador, certificate of Ajibika Campus Ambassador, which you can prepare and download within a minute. From now on, you can participate in 1,000+ international level to verify this certificate. Teaching tips for teacher, health tips for parents, health tips for teens. Gamification tools for teacher. You can join Ajib alone. You can check out our previous student services website for free and many more. Dear RGP well-wisher, we promised previously, but lack of technical problem, we are late sending on time. This is a great opportunity to collect your previous conditions to solve all issue from our website. Now you can enroll, reset, password, everything, and check with you for all of your details. It's a crowded request to check all pattern pages on our website. She like and still benefited. Thank you, but note that without an account or login, you cannot enjoy service. At present, we are going to start our 2,187 webinar, which name is Hypertension, Take Action, No Tension. And today our speaker's name is Dr. Shunil Malhar Kulkhani. He is from India. Before I hand over the stage to our speaker, sir, must share a little bit about him. Assistant Professor BWDU, College of Nursing, Strangil, India. Now, very important moment for me to invite our speaker to IGP with his Now, very important moment for me to invite our speaker to IGP with his presentation. Hello, sir. Good evening.
Hello, good evening, ma'am. Can you hear me properly? Hello, can you hear
Yes, sir.
me?
I can hear you. So, the stage is you. You can
Okay,
start your presentation now.
okay, ma'am. Thank you. Thank you for this opportunity. Good afternoon, good evening, and good morning. Dr. Sunil Kulkarni, is discussing with you a very important topic in the sense of a disease that is called as hypertension. Hypertension, take action, no tension. So you have to take the action. You can live your whole life as a normal person and you will have not any tension. If you are taking the tension, ultimately it will lead hypertension. If you are having hypertension, it leads tension. These are the one another sides of the coin. World Hypertension Day is celebrated on the 14th May next week. It is there, uh, 2024, and the theme for this year is measure your blood pressure accurately. Measure your blood pressure accurately, control it, live longer. Means everyone has to take each one's own blood pressure, or wherever possible they have to take the blood pressure regularly and accurately. Keep in a normal limit. If you are keeping it in normal limit, you will live long. Our presentation having few points as a guideline. What is hypertension? What is prevalence? Means how many cases are there in the world. Risk factors who are causing or who are leading to get the hypertension. How you can identify clinically, that is signs symptoms of hypertension. Diagnostic by using certain tests, how you can identify the hypertension or its underlying the causes, treatment, preventive measures, and curative measures or medication for that, and very important, prevention of the complications. These points we are discussing today. Chronic and long term raised blood pressure. It is measured in of Hg. Means millimeter of mercury. Hg means mercury. The device name is sphygmomanometer. With the help of sphygmomanometer device, we are measuring the blood pressure. Commonly, we are calling as blood pressure measuring apparatus. Blood pressure is measuring by using two numbers are there. What is this two number means? One is the systolic blood pressure, second is the diastolic blood pressure. I have written just BP as a blood pressure short form. What is the systolic blood pressure means? Systolic blood pressure means you are measuring the blood pressure when heart beats takes place. When your heart beats take place, blood from the heart comes out, so increase of the blood pressure occurs. That is called as systolic blood pressure. Another one is diastolic blood pressure. Diastolic means relax. Diastolic blood pressure means blood pressure measured when your heart is rest between the beats. So our heartbeats are there. There is short time pause is there. Again, it beat continues. So when you are measuring your blood pressure, when heart beats are in a resting state, that is called as diastolic. Systolic, when heartbeat occurs, when it is in resting condition, that is called as diastolic. Both levels, both numbers are very important. World Health Organization, which is controlling or helping to all the world over health organizations, what they are recommending? They are recommending take the blood pressures three times, not single time, three times in a 3 minute in sitting position and take on the right hand. So there are few terms or conditions it is mentioned here because for the universal, unique blood pressure level will get it. What it is a three times you have to measure the blood pressure within a 3 minutes in sitting position and take on a right hand. So it will become as a universal. Hypertension is major public health problems overall the world. Overall the world. So this is a different ways how we are taking the blood pressure. In one picture, you can see one nurse is taking blood pressure of the patient. The patient is different, so it is taken in a lying down position with dial type of sphygmomanometer. This is a dial type of is there. In advance, there are some monitors are there. We are connecting this BP monitors to the BP cuff. So it will give continuous blood pressure measuring record. Then at the home you can use this type of monitors or digital blood pressure apparatus is there. So a person with little bit understanding, the person will take or patient will take its own. So this is the proper universal position in a sitting position and take the right hand. This is a sphygmomanometer apparatus is there including blood pressure. This is a cup and this is a balloon is there. Through the balloon you are increasing the air. This gives pressure on the blood vessels. That will be transmitted to the sphygmomanometer which is calibrated and gives certain numbers. So systolic when heartbeats are there upper number is there. When heartbeat disappears to here that is a diastolic. These are the two numbers are there. So these numbers are representing certain meanings are there. Blood pressure in adults, we are saying systolic 120 mm of Hg, whereas diastolic 80 mm of Hg. Pre-hypertension, the state is calling as 120 to 139 systolic blood pressure, whereas diastolic 80 to 90 mm of Hg. And as a case diagnosed, we are considering hypertension when blood pressure goes above systolic 140 and diastolic 90. The range is 140 to 159 and 90 to 99 for stage 1 and for stage 2 more than 160 systolic whereas more than 100 mm of He diastolic. So why it is important pre-hypertension because in this case when you are identifying early and taking proper measures it will lead the range of blood pressure within a normal with non-pharmacological measures or minimum requirement of pharmacological measures. So what are the dangerous level of the blood pressures? There are two dangerous situations are there. One is called as hypertensive urgency. Immediate hypertensive urgency, it means when systolic blood pressure is more than 220 mm of Hg and diastolic blood pressure is 120 mm of Hg. Still, it is a early stage where the major symptoms are not fully appear. It is a early stage. If it is remain long time, then it turns into the hypertensive emergency. Immediate action is important. Otherwise, there will be chance of bleeding to various body parts. So hypertensive emergency, it is called when systolic blood pressure is 180 mm of Hg and diastolic blood pressure is greater than 120 mm of Hg with the signs of organ failure. Brain is not functioning, heart is not functioning, kidney is not functioning, lungs are not functioning, or dizziness. Patient will be in a confusion state and there will be shortness of the breath. The respiration rate will be very high and it will be very shallow. Patient is struggling for the respiration. So important that accurately measuring of the blood pressures. So when it is possible when you are eliminating three important errors of during the measuring of blood pressure. Which are these three important errors are there? One is the observer error, it means who is measuring the blood pressure. Second, the instrumental error, it means what device we are using. The device working is there, calibration is there, connections are there, function is there, leakages are there, what is there. Third is a subject error. Subject error means patient. So observer errors, when observer is having defective vision, hearing, or interpretation problem is there by any reason, because of environmental reason or individual vision activity is not clear, not using proper specs, or it is a dark or dim light is there, or hearing disabilities because of by aging process, or by there will be noise. By any reason, if the observer is not measuring properly, accurately, that is called as observer error. Second is the instrumental error, means when you are using the instrument like cup, leaking of the wall, unclear marking of the blood pressures. So any device is not working properly, that is called as, or for the device if it is need for electric supply, if it is electric supply is inadequate, that also leads to instrumental error. Third is a subject error, when environmental conditions are there, maybe excessive hot or excessive cold, dim light is there, high pressure, low pressure, high ventilation, low ventilation, or important emotional status of the patient. When patient is happy, there is maybe chance to increase of the blood pressure, whereas in sad depression, blood pressure may be low. And unstable of the patient, there are difference may occurs, it may be minimal, but there will difference in blood pressure occurs if patient is in sitting position, lying down positions, or in prone position or semi-fowler positions. So these three important errors should be eliminated to get accurate blood pressure. The blood pressure, it is classified for two purpose, understanding purpose is there. Both are important for identification, treatment, but to get the idea clear, we are classifying in the two parts. Two classifications are there. One is called as primary or essential hypertension. Second is secondary hypertension. Primary or essential. Keep in mind here essential means required, no. Here essential means the hypertension cause is unknown. When hypertension cause is exactly unknown, in that cases it is called as primary or essential hypertension. When the cause is unknown, and this is danger because 90% of the hypertensive cases are identified when you are undergoing certain clinical examination, and because they are not showing any cause of hypertension, so there will be very less or unclear sign symptom of the hypertension. That's why it is essential regular checkup and get the find out level of the blood pressure. Secondary hypertension, it is caused by certain diseases. It is caused by certain diseases are there. For example, kidney diseases, kidney tumors or tumors of the adrenal gland. Adrenal glands, small glands are there just above the kidney, and congenital narrowing of the aorta. Aorta is the main branch from the heart. Blood pumps into the various blood vessels. If it is get blocked, the pressure will be ultimately increase. It accounts only 10% of hypertensive cases. So when there are certain sign symptoms are there, we are identifying it only 10% cases. So you are giving more intention to identify the essential hypertensions or whose cause is unknown. Whose cause is unknown. So how our body, everyone's body keeps blood pressure normal. In certain situations, it will fluctuates within the normal range. Within the normal range. So our blood pressure is controlled by mainly four important measures are there. One is our brain cardiovascular center is there that controls the blood pressure. So certain stimulations are there. It will be increase or decrease the blood pressure and keeps in normal range. Second is the kidney. Kidney is the second member is there. Certain enzymes are released from the kidney and they are controlling blood pressure. When it is low, they stimulate the enzymes to increase the blood pressure. If it is increased in normal process, it will relax of the blood vessels and decrease of the blood pressure. Third, certain hormones are responsible for vasodilation or vasoconstriction, depends on the particular situations and keep the blood pressure in normal range. And last one is the local. At the local level, any stimuli is there, it leads vasoconstriction or dilation. So very important is first nervous system, second kidney, and third heart. Fourth one is your peripheral blood vessels anatomy or structure. These four importance are there for maintaining the blood pressure. So this scenario shows how the progress of hypertension occurs or what is its scope, how much it is spread and how much its intensity. An estimated 1.28 billion adults of aged 30 to 80, 79 years of the worldwide having the hypertension. That means almost one third are living out of that one third, two-third are living in low and middle income. Low and middle income groups are there. Second, an estimated of 46% of adults with hypertension are unaware they have the condition. So this is very serious point. Is there 46? You can say our 50% are not knowing. It is like unessential. They are not aware about their hypertension. When the complaints are there, so it is a somewhat more or serious level of hypertension occurs, then patient is identifying or reporting signs symptoms or if patient is visiting to the clinic during the examination, it will be identifying. Third, less than half of the adults, 42% with hypertension are diagnosed and treatment. So 50% are unaware. Out of that, 50% are only diagnosed and treated. It is treated, not clear about fully treated, properly treated, completely treated. Only they are taking the treatment. Approximately 1 in 5 adults, 1 in 5 adults, that is 21% with hypertension have it under control. So whatever the not knowing diagnosed cases, 21% they are under control. That means they can live normal life with hypertension. Hypertension is major cause for premature death. About 10% of the total death, one cause is the hypertension. One of the global target non-communicable diseases to reduce prevalence of hypertension by 33% from 2010 to 2013. At present, it is around 40%. Within 7 years, within 6 years, we are trying to reduce 33%. Means we have to take major and drastic actions to minimize at the maximum level. Very important to control or prevent hypertension. That technique is called as tracking of the blood pressure. Tracking of the blood pressure. Tracking means we are observing continuously. So what is exactly meaning? Periodically checking of the blood pressure from the childhood to adolescence to adult life. So from the childhood, periodically we have to take the blood pressures up to the adult life. So what it shows? It shows low blood pressure remains low, means hypotensive, whereas high blood pressure cases will remain high blood pressure. If you are checking or tracking it, we can identify at childhood age who are hypertensive members and who are hypertensives. Both needs treatments, but today we are discussing about hypertension. So we are mostly dealing with the hypertension, but hypotension also needs the treatment. Hypotension also needs the treatment. Both conditions are identifying by tracking of blood pressure. This is the best way to identifying hypertension risk factors at the earliest. When you are identifying at the earliest, we can control with non-pharmacological measures or with minimum pharmacological measures, and the person will live normal with hypertension with minimum measures. This is a one type of picture, you can say how it is started from the birth of mothers. From the mother it will start from the birth to infancy to childhood to adolescence and adulthood. Continuously it is very important to take the blood pressure. Blood pressures, many of them are do not having exactly causative factors, but there are certain risk factors are there. Risk factors are there. They are described by two ways. One is the non-modifiable factors and modifiable factors. So modification means changes. In certain factors, we cannot make any changes. These factors are called as non-modifiable factors. And certain factors, the human being can make changes. These factors are called as modifiable factors. These are very important because once you know the risk factors, to prevent the risk factors, to minimize the risk factors, to eradicate the risk factors, it will reduce the hypertension and the blood pressure will remain in normal range. So the causes are there: primary or essential hypertension and secondary hypertensions. So non-modifiable, we cannot change the genetic structures, we cannot change their age, we cannot change their ethnicity, or we cannot change the progress of certain body measures. So these are the various factors are there, or risk factors are there. We are dealing with each one by one. So first regarding the age. So blood pressure generally rises with age in both sexes. So above 30 years, gradually physiological process, there will be less elasticity towards the old age of the blood vessels, so it leads increase of the blood pressure gradually. But very important point, keep in mind, rise in the blood pressure is more in those with initial high initial blood pressure. So if we are identifying early controlling, this high initial blood pressure will remain normal range. If it is not identifying, there will be drastic condition, urgencies will be there, or emergency hypertensive condition may occur. Secondly, both sexes, male and females, there is no any difference, but in sometimes, in some situations, there will be difference can occur, especially adolescents and adults, male having higher blood pressure than the female. But on an average, it will be equal. There will be little bit changes in male adults and adolescents. Third, the hormonal family planning methods is the contributory risk factors to raise the blood pressures. So in adult married women, reproductive age women or males, when they are using hormonal family planning methods, estrogen, it will lead increase of blood pressure. Third, non-modifiable because we cannot make changes is the genetic structures. If both parents are having hypertension, there is chance of 45% possibility of all the children will get the hypertensions. Hypertension. If one of that is there, there is slightly lesser possibility of hypertension. Hypertension. If it is there more than one child, one of that, or if out of two out of three, two may get hypertension, one may remain normal. So very important, you have to find out the parental hypertension. Parental hypertension, especially we are identifying ANC hypertension before birth. So you have to take the blood pressure of husband also before conception, during pregnancy. Next is ethnicity. Ethnicity, especially black community is having the high blood pressure than the white. So ethnicity we cannot make changes. It is the place where they are taking the birth. So four important non-modifiable factors. These are: one is the age, second is the gender, third is a genetic factor, fourth is a ethnicity. Then modifiable factors. Modifiable factors means we can make changes in these factors or in these lifestyles. So these risky lifestyles we have to prevent will not having hypertension. If you are identifying early and changes occurs, your blood pressure will remain in normal range. First modifier factor is the obesity. Obesity is high risk factor for hypertension and many other diseases. You can see the pictures. It is like a football. So raise of the blood pressure is correlated with the speed of weight gain. If you are gaining the weight 1 kg per month, the raise of the blood pressure will very fast. Will be very fast. Raise of the blood pressure is more in the central obesity than the overall. Central means middle part is there. Middle part, abdomen and your legs, waist area. Second, unhealthy habits related to the salt intake to get the taste. To get the taste, especially Chinese and Japanese, these are the using salty, smoky, or tasty foods. They are adding various salts, so it leads daily intake of the salt, sodium chloride more than 7 gram. It leads rise in blood pressure. So sodium salts are there, they will lead blood pressure. But some salts they are useful. Potassium, calcium, magnesium, they are helping to reduce the blood pressure. So certain sort of potassium, calcium, and magnesium can use to control the blood pressure or to prevent the hypertension. So obesity and salt intake we can make changes. Next is the saturated fat. Saturated fat. Saturated fat leads rise in blood pressure, also rise in cholesterol. We can see in the common it is a animal fat sources. Animal products are there. Animal products like meat, cheese, eggs, these having rich source of saturated fat. So they leads lining on the blood vessels, increase of the blood pressures as well as they are increasing the cholesterol. So double effect will be there. Double effect will be there in rising of the blood pressure. More than 30 ml per day unsaturated fat is hazardous for health. Unsaturated fat means plant sources of the fat, maximum 30 ml. So you have to think that you have to consider all nutrients, including fat amount, that total should not go more than 30 ml. As advanced age is there, you can reduce its amount because already body degeneration process is going on. Next modifiable factor is dietary fibers. Dietary fibers, they are reducing the low density cholesterol, low density lipoprotein and cholesterol. So these are the salads, vegetables or fruits. If you see certain, especially nowadays, American dish, half of the dish is with the salad, half of dish is with the fruits. That is very important. Fruits, vegetables, and salad. Alcohol consumption, there is high risk to raise of the blood pressure because it leads toxic effect of the liver, and liver secretes the renin, which leads increase of the blood pressure. It also shows that abstinence or reduce of the alcohol consumption reduce the blood pressure. Abstinence, no consumption of the alcohol, or reduce gradually amount of alcohol. Then physical activities, exercise, various type of exercise are important. It reduces body weight, obesity also get reduces, and decrease of the blood pressure because this fat will compress the blood vessels, as well as this fat lining deposit the blood vessels, block. Okay, I'm sorry for some interruption was there. Next factor is socio-economic conditions. Presently, it is shown that blood pressure is seen in higher socio-economic condition status. It also having high in middle and low because not taking care of it or not identifying properly. Then stress, fat intake, and less physical activities, especially seen in higher socioeconomic conditions. Others, mainly irritating situations of noise, humidity, temperatures, any other stress factors from the environments like wars are there or inflations are there. These also causes blood pressure. So more important risk factors are there. One is related to your diet, salt intake, fat intake. Second is the obesity or lack of exercise. Third is stress factors, taking excessive stress. And fourth one, not regularly checkup of health. Not regularly checkup of health. These are four important factors are there, risk factors are there, which leads hypertension. This is a medical form is there, pathophysiologies. Just keep in mind only which organs leads the blood pressures or control the blood pressure. Blood vessels, brain, heart, and kidney. These four important are there. Changes, vasoconstriction decrease the volume. Vascular growth is there, less elasticity. The inflammation, less elasticities are there, blocking by platelets. Kidney, if it is affected or adrenal glands are there or infection of the kidney, kidney will secrete renin. Whereas brain, cardiovascular center, these are controlling theirs, and heart. If heart is not getting sufficient blood, it will not work properly, or overstimulation of the heart may increase pressure of the heart, cardiac will be increased. So how to identify hypertension? The simplest way is checking of the blood pressure clinically. Whereas the common sign symptoms are there. These are dizziness, you are feeling something unstable, then you are having vomiting because of severe headache, fainting. Sometimes there will be collapse, low blood pressure because blood vessels get damaged, bleeding will occur, nausea, vomiting. Very important sign symptoms you have to keep in mind. First is a severe headache. severe headache. Second, vomiting, nausea and vomiting. And third is a fainting or confusion. Fainting or confusion. And fourth one is blurred vision. You cannot see properly. Blurred vision. So diagnostic, the simplest way is diagnosed by measuring the blood pressure. Blood pressure. But for the treatment purpose, we have to give the treatment to the cause as well as we have to give the treatment for hypertension. So to identifying the underlying cause, there are some tests we are carried out. So blood tests we are carried out for electrolytes, sodium, potassium, calcium, urea, nitrogen, creatinine is there. So it gives the idea of kidney functioning. Kidney function is abnormal, so that may be cause for the hypertension. Second, lipid profile, fat lipid profiles are there. It will gives the idea increase of cholesterol level. So identify the serum cholesterol level. Third, specific test for the hormones of the adrenal gland. Adrenal gland hormones are there. ADH hormone is there. Then fourth one is the blood glucose level, identification of diabetes. You may say why diabetes and hypertension relation is there. In diabetes, blood glucose level is increases and that also damaging elasticity of the blood vessels, also decreasing level of the lu- lumen or passage of the blood vessel. Then urine tests to identify the electrolytes and certain hormones. When kidney get damages, it leads excessive abnormal secretions of the kidney and that will be observed in the urine. Ophthalmoscopy to identify ocular damage, blurring of the visions, diminish of the visions, and UHG, CT abdomen we are identifying, especially adrenal gland, liver conditions. So to identify the underlying cause, we are doing some other tests. But very important is just simple measure of measuring of blood pressure. So management of the hypertensions, mainly there are three important approaches are there as World Health Organization are recommended. First is a primary prevention, secondary prevention and tertiary prevention. In some books they are giving four, that is pre-morbidial prevention. What is pre-morbidial prevention means? Take the measures to eliminate the risk factor. To eliminate the risk factor, in other words, maintain healthy lifestyles, healthy diet, salt intake, exercise, no bad habits like smoking, alcohol consumptions, well manage of the stress. These comes under pre-morbidial prevention. Primary prevention reduce the risk factors at the maximum level. There are two strategies are there, population strategies and hardy strategies. Whereas secondary preventions, early detections to further progress of the disease or damage and give the early and prompt treatment so we can maintain the blood pressure in normal. And tertiary level prevention, if late identification is there, if there is non-adherence cases are there, we are helping them prevention of the complications caused by the hypertension. In short, keep in mind every body part will affected because blood supplies to the each and every body parts, so there will decrease function of various body parts. Next is the rehabilitations, give certain help to increase their potentials up to maximum level. So primary, secondary and tertiary, three important strategies are there for management of the hypertension. Population strategy, what is mean by population strategies? It is also known as non-pharmacological therapeutic actions. Non means no. Pharmacology means drugs. So here we are not using drugs. So it is the best and safe and everyone can adopt this measure. It doesn't mean that every time with this blood pressure will control. No, we are taking help of medication, but its dose will be minimized. So what is the first important that is a nutrition. What we eat. What we eat that is important. First reduction of the salt less than 5 gram per day. So salt intake means additional from outside what we are taking the 5 gram salt because some of the fruits, vegetables, roots already they having certain salts. So you can reduce up to 3 milligram. So it will be managed up to 5 gram per day. Second, saturated fat intake should be less than 30 gram per day. 30 gram per day. So very high saturated mainly in animal sources. So better to use plant sources of various oils. It also reduce the amount in whole day 30 ml per day. Next, avoid smoking and consumption of the alcohol because along with the food they are taking the alcohol, so it is combined effect is there to increase the blood pressure. You have to take the food appropriate to your body requirements. So how much energy you need to do the various activities, according that you have to take the calories. You have to take the calories, so 50, 30, 20 in that way. If you are doing exercise, you have to increase its amount. If you are sedentary, you have to decrease the amount. So from the nutrition, there is no fat saturation, increase of the cholesterols. Use of fruits, vegetables, and salads regularly or daily, so that will minimize fat intake. Second important is the weight reduction. Weight reduction, how it is measured? Measuring by the body mass index. Body mass index, how it is calculated? It is calculated height in meters divided by our body weight. So that percentage, if it is more than 25, you are becoming as a obese. Regular exercise, minimum it is requirement 30 minutes per day. Various type of exercise you can do. It may be aerobic, anaerobic exercise are there. Best simple ways are there. You are walking, jogging, simple ways are there. Swimming. With you can take help of other uh, measures like gym may be added. You can take as a yoga, meditations for best performing various exercise. Best and very important is keep body active. When you are active, working with your body with minimum devices, you will having normal body weight, normal blood pressure. Behavioral changes, certain lifestyles are important here. Yoga and meditations will maintain your stress in normal, as well as the exercise leads proper circulation of the blood. There will no deposition of the fat and cholesterol. Involve the work at home as well as workplace actively. Most of they are complaining we are having sedentary work, we are having kitchen work, but you have to do actively with using minimus devices. Still, you have to take a frequent break and do simple exercise at the home as well as at the workplace. Tracking of the blood pressure is important. Keep regular medical follow from the pregnancy, birth, infancy, childhood, adolescence, adult, old age. So in early stage we will identify it, and if starting non-pharmacological and pharmacological measures, we can control the blood pressure. Stress management, this is a recent a big main cause is there. That's why the hypertension occurs in early age, and its complications also observed in early age 20 to 30. I've seen some cases they having heart attacks, strokes, and obesity. Sedentary life is there contributed to the stress. So all type of stress you have to minimize. So noise at the home you can reduce these. You can use protective measures. Yoga, meditation, get the relaxation is there. Healthy diets from the nutrients, fatty or toxic or cholesterols. That type of stress will body stress will minimize. Rest around 6 to 8 years. 8 years rest is important, and that rest is timing 10 to 6 a.m. Not daytime 6 hours, not proper, not late night. So this is very important time 10 to 6 a.m. 6 to 8 hours. 8 hours is advisable maximum. Self limitations. So you know where the limitations are there. You have to avoid certain your expectations or actions, or increase your potentials to perform the actions. Don't take the stress, but take the actions. Learn the various skills. Proper time management is there. Exercise doing is there, and friendly behaving with self and others. Friendly behaving with self and others. Having good social network. Then this is applying for all the population. This is applied for all the population. Next, high risk strategy, because our healthy members, their resources and the population, if it is very high, in that cases what we are approaching to the risk members. So from the general population, we're taking the blood pressure, we are identifying risk cases with observation or asking certain risk factors. So use screening test to identify population. The simple measures taking of the blood pressures, we are identifying increase of the blood pressure. In identifying, you are again adding that you are doing the specific test to confirm the hypertension and underlying cause. Then keep tracking the close relatives of the risk population as well as known pre-hypertensive or hypertensive cases. Pre-hypertensive means the blood pressure is near about 2 hypertensive level, that is about 135 to 40. So it may increase at any time. So these are different high risk populations are there. Those parents are having sedentary life is there, smoking, alcoholism, fat use is there, stress takings are there. These are the risky groups are there. Next, early detection is important because we will manage at the early stage to avoid further progress of disease and its complications. With the possible of screening tests and laboratory measures are there. Tracking of the blood pressures, taking the blood pressures every health setting, at every health setting and at every visit, even it is in a school, it may be industries or in common public places. Periodical health checkup is very important. Treatment, we are providing treatment to both. One is for the risk factors, cause, underlying cause, as well as hypertension. With non-pharmacology and pharmacology, we can reduce 50% of complications of hypertension. Treatment, there are various drugs are available, they are working at the various levels. As I told in a pathophysiology or in the physiology, one is acting on the brain, second is acting on the heart, third is acting on the blood vessels, fourth is acting on the kidney, fifth is acting on the stress. So these are the various drugs are there, they are acting to various areas, and they will control by stimulating the cardiovascular centers to manage the blood pressure, or they are control relaxing or constricting of the blood vessels to minimize the blood pressure, or removing extra volume of the blood from the blood vessels. And some drugs which are using for underlying cause, disease cause. If the cause is treated, the enzymes, hormones, they will not cause effect on the blood vessel or cardiovascular centers. One of that is called as angiotensin converting enzyme. Angio means blood vessels. Tension means tension. So the drugs are like enalapril, linopril. These are acting on the blood vessels, and the blood vessel relaxation is there. Also, they are preventing damage of the kidney, so there will no secretion of renin hormone. Second, angiotensin 2 receptors blocking. So these receptors they are blocking, working on the blood pressures or cardiac centers. So they are maintaining the blood vessels lumen. Also, they are preventing damage of the kidney. The drugs like temilastine, calcium channel blockers, including the amlodipine, pilodipine. These are the most commonly drugs are using for the relaxation of the blood vessels. These are working on the blood vessels. Diuretics, especially hydrochlorothiazides or chlorothiazides are there. What they are doing, they are removing extra water from the kidney which is present in the blood volume. So blood volume decreases, blood pressure decreases. So these are the different areas they are working on the various areas. So there may be combination having better effect. These are the drug groups are there. These are examples of their and these are their actions. So the drug role is mainly important when you are not controlling in urgency or in emergency or in certain situations. Most of blood pressure you can control with non-pharmacological measures. These are the some drugs are there present in the mainly forms of tablets. Mainly forms of tablets. Next is very important is patient compliance. What is mean by patient compliance? Patient compliance means when the person in contact, you have to identify is normal, pre-hypertensive or hypertensive. If it is hypertensive, you have to give the continuous care to them, advice to them. So they should adhere the treatment, non-pharmacological and pharmacological. That process is called as patient compliance. Patient should take proper treatment and maintain normal range of blood pressure. That whole process is called as patient compliance. Patient should not be defaulter. These are the certain causes are there, socioeconomic, money is not there, not buying the drug, not reaching to that. Therapy related, certain complications are there, not suitable drugs for the patients, certain conditions of the patients, other comorbidities are there, so patient is not taking properly medications. Patient related conditions are there. It may be health team members relations to that, the negative attitude towards certain drugs, members, agencies are there, healthcare facilities are unavailable to the certain time duration drugs. By your measures you have to remove these all the causes of poor adherence. So patient must get all the facilities, all the advices, all the diagnostic and therapeutic treatment, tracking of the defaulters and correcting the underlying cause, assessment of the level of blood pressure, risk factors, and early signs of complications. So, early signs of complications will prevent damage of various organs and its impact. Involvement of the family members in patient care. So, family members all together they will take care of self as well as family members to adhere, to maintain, or to take the blood pressure advices, drug, diet, exercise, stress management. Next, prevention of the complications. Complications, every body organ can damage, blood supply is there. Common complications are coronary heart disease, we are saying as heart attack, stroke, decreased blood supply, the very important organ, brain, peripheral artery, blood vessels, there will be gangrene, death of the peripheral organs, Renal is not functioning, renal failure, heart is not getting the blood, heart failure. These are the various serious complications are there. In other parts, lungs, eyes, joints, all the organs will get affected. So very important, adhering to the treatment and regular follow-up is the best way to prevent the complication. Then rehabilitation, in some cases, if there is any complication occurs related to body, medical rehabilitations, damage or loss of certain body parts, you have to give certain processes. Vision is defective by using the specs, correction of the blood supply to the eye. It will increase vision. Vocational in loss of certain body parts, vision, hearing, abilities in that you are use special guidance or trainings to get the suitable job. Psychological, especially those are having a stress factors, they needs guidance and counseling. Guidance and counseling needs to each and everyone. Pregnancy, delivery, early childhood, adolescence, adult, and old age. All the members are very important best way to manage the stress. Social rehabilitation, keeping good relations with the family members and others. These also act as a treatment, stress management, good interpersonal relation because nowadays this is very difficult. We having thousands of online friends, but there is no very close friends. Are there no good relations with the family members? Very special condition that is called as pregnancy and hypertension. In the pregnancy, the placenta produces the renin which increase the aldosterone, which leads along with estrogen, the female secreting organ is hormone is there. They can increase blood pressure. Pregnancy placental changes along with other risk factors, it leads increase of the blood pressure. That is called as gestational hypertension. Gestational, it is identifying during pregnancy. There is very danger condition that is called as eclampsia, means high blood pressure during pregnancy. It is identified with severe headache, blurred visions, and convulsions. Convulsions. It is a serious conditions, but it's good. It occurs very rare. Occurs very rare. It is untreated pregnancy is there, hypertensive case. This may cause eclampsia. The sign symptoms, these are mostly similar to the hypertensions. You have to consider along with the pregnancy. So starting from the adolescence, marriage, pregnancy. Specific treatment is given. Managing of the blood pressures, drugs are important. Blood pressure increases, blood loss may occur, so it leads we are using anticoagulants that were seizures are there, convulsions are there. So anticonvulsants drugs are given to avoid the seizures and to strengthening the functions of the lungs, expansion of the alveoli. We are giving certain corticosteroids. Corticosteroids, blood pressure drugs to the mother, as well as anticonvulsant drugs are given to the mothers. In summary, hypertension, I can say it is we have created the diseases. So we must know what is the disease process of hypertension, risk factors, preventive and medical management, and the complications. In single word, complications are many. Each and every organs get affected. In summarize, I will say that people with high blood pressure and diabetics, those are conditions brought about by the lifestyles. Your lifestyle is mainly responsible. Risky lifestyles causes hypertension and diabetes. So diabetes again leads to the hypertension. If you change the lifestyle, those conditions will leave. If you change the lifestyle, those conditions will leave. So very important, healthy lifestyles will have healthy life. Thank you. Very special thanks to the IGP teams as well as uh, the audience because they are attending patiently and interestingly. Maintain your lifestyle healthy and remain healthy. Live long. Thank you once again.
Thank you so much, sir, for a rich content presentation which can impact our knowledge seeker surely. After your presentation, I hope our knowledge seeker can learn something new, which was our only intention. Learn and grow together, RGP knowledge seeker. Once again, thank you so much, sir, for your presentation. Now, sir, it's time for our question answer session, which is the one more valuable part of our regular webinar. Honorable sir, please stay with us. After a short video, we will back in our session part 2. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have an webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Welcome back, sir. Welcome back to our participant. The IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Dear IGP knowledge seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have a webinar certification and online quiz competition. Sir, I think after a wonderful presentation, our participant can understand the topic very clearly. There's no questions from our participants. So once again, thank you so much, sir, for your EJP. We have learned a lot from you with new topic. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable sir, hope to see you again with a new topic and a new date. Thank you, sir. Take care.
Thank you, ma'am. Thank you, whole entire IGP team, for providing such a big opportunity.
Honorable sir, before you move to the next, if you want to leave this studio, you can. Dear IGP, now let's take a step for the most ranking, which is an online quiz competition, which is our regular webinar activity. We change a few processes for online quiz competition. Note that after live, no one can participate. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. Now, time for the online quiz competition. To join the online quiz competition properly, please follow my instruction carefully. For some technical problem, we cannot continue the session from our website. So, to join the quiz session, you have to go www.slido.com and the code is 4166688. I repeat the code 4166688. After a short video, we will start our quiz session. With 15 people, we are going to start our quiz right now. First question is: this fiscal policy require no new legislative action to take effect? Is it option 1 or option 2? Option 1 is the right answer. 38% people are right here. Second question is: take no further action. Is it option 1 or option 2? Option 1 is the right answer. 79% people are right here. Third question is: no take, no action. Is it option 1 or option 2? Option 1 is the right answer. 63% people are right here. Fourth question is: what action should individual with hypertension take for kidney health? Is it option 1 or option 2? Option 2 is the right answer. 100% people are right here. Fifth question is: which action would the nurse take before administration to a patient with hypertension? Is it option 1 or option 2? Option 2 is the right answer. 58% people are right here. Sixth question is: forgiveness means take no action. Is it true or false? Option 2 is the right answer. 58% people are right here. Seventh question is: wait patiently, take no action, sit. Is it option 1 or option 2? action will the nurse in the hypertension clinic take in order to obtain an accurate baseline BP for NUPT? Is it option 1 or option 2? Option 2 is the right answer. 30% people are right. Our second last question of the session is no official government willing to take action. Is it option 1 or option 2? Option 2 is the right answer. 68% people are right. Our last and final question of the session is payroll take no action upon sale. Is it option 1 or option 2? Option 1 is the right answer. 20% people are right here. Congratulations to our online quiz competition winner. Top 10. Congratulations again. We will take a few minutes for finalize the result. After that, we will issue our online quiz competition certificate on official Facebook page and group Institute of Global Professional. Congratulations to our online quiz competition winner. Top 10. Congratulations again. We will take a few minutes for finalize the result. After that, we will issue our online quiz competition certificate on official Facebook page and group Institute of Global Professional. Congratulations to our quiz competition winner. Top 10. Congratulations again. We will take a few minutes for finalize the result. After that, we will issue our online or official Facebook page Institute of Global Professional. At the end of our session, we can say properly fit your still never stop learning, cause life never stop teaching us. Be happy, stay safe. See you again and again. We want your participation in every program. If you live a happy life, try to avoid other people or things Albert Einstein. Before I start, hit the like button. Again, wants to thank all IGP knowledge seekers for their active participation as always. See you again in the next session. Thank you.